If you're past 60, there's something most people won't tell you. Doctors don't always view older patients the same way they do younger ones. That difference can affect the care you receive, sometimes in ways that put your health at risk. You might be surprised to learn how often real symptoms are dismissed, how treatment decisions are influenced by hidden assumptions, and how age itself changes what doctors recommend. These aren't just small misunderstandings. They can shape the rest of your life. Staying informed is your best defense. Today, we're diving into 5 uncomfortable truths about what many doctors really think when treating older patients. Things most seniors never hear directly. You'll learn why some warning signs slip through the cracks, how unconscious assumptions can limit the care you're offered, and the small but powerful steps you can take to make sure your health is taken seriously. Each point is designed to give you insight and control, not fear. And here's the key. Our last truth is the most shocking of all, and it may completely change how you approach your next doctor's visit. So if living stronger and smarter after 60 matters to you, make sure to stick around until the end. And while you're here, hit that like button and subscribe. It helps us bring you more practical advice to protect your health and independence. Truth 1. Doctors often see symptoms as just aging. One of the most frustrating realities for many older adults is how often real health issues get dismissed as just a part of aging. The truth is, aging does bring natural changes, but that doesn't mean every new ache, every bout of fatigue, or every memory lapse should be written off without a closer look. When doctors make the mistake of assuming symptoms are simply the result of getting older, the consequences can be serious, and sometimes even life-threatening. Think about it this way. If a man in his 30s comes in complaining of constant tiredness, most doctors would immediately run tests to check thyroid function, anemia, or even heart disease. But if a man in his 60s or 70s reports the same thing, too often the response is, well, that's what happens with age. The danger is that serious conditions, like early signs of heart failure, diabetes, or sleep apnea, can go completely unnoticed until they become much harder to treat. Take shortness of breath, for example. Yes, as we age, stamina naturally declines. But if you suddenly notice you're winded after walking a short distance when you never were before, that's not just aging. It could be heart disease, lung issues, or even anemia. Yet countless seniors walk out of appointments with nothing more than a shrug and reassurance that they're just getting older. This type of dismissal delays proper diagnosis and steals valuable time that could be used for treatment and prevention. Memory issues are another classic example. Occasional forgetfulness happens at any age, but persistent memory problems or confusion may be early indicators of dementia, vitamin deficiencies, or even medication side effects. When those concerns are brushed off as normal aging, families miss the chance for early interventions that can slow decline and improve quality of life. Why does this happen? Well, part of the issue is training. Many medical programs focus heavily on acute illnesses, but, devote less time to the complexities of aging. This lack of specialized focus means doctors sometimes rely on assumptions instead of, digging deeper. Another reason is bias. Subtle, often unconscious beliefs that older bodies are simply wearing out and not worth the same level of aggressive investigation as younger patients. But here's the empowering part. You don't have to accept being brushed aside. Seniors who prepare for their appointments tend to get better results. Write down your symptoms in detail, when they started, how often they happen, and what makes them better or worse. Bring that list with you and insist it be considered. Don't be afraid to ask directly. If I were younger, what tests would you order for this? That one question alone can shift the entire conversation. It's also important to bring an advocate with you, whether it's a spouse, adult child, or trusted friend. Doctors are less likely to dismiss symptoms when another set of ears is in the room. An advocate can also help repeat concerns if the doctor seems to brush past them. And remember, getting a second opinion is not an insult to your doctor. It's your right. If something doesn't feel right, trust your instincts. Many seniors have avoided serious complications by refusing to accept it's just aging as the final word. Engaging with your health in this way isn't just about medical outcomes, it's about dignity. Every older adult deserves to have their concerns treated with the same seriousness as any other patient. Too many lives have been cut short or limited in quality because early warning signs were ignored. By speaking up and pushing back against the just aging label, you safeguard your independence, your mobility, and your peace of mind. So, let me ask you, has this ever happened to you? Have you shared a concern with your doctor only to be told it's nothing more than a normal part of growing older? Share your experience in the comments below. Your story might not only help you feel heard, but could also encourage another senior watching this video to push for the answers they need. Truth 2, time pressure means seniors get rushed. One of the biggest frustrations many seniors face at the doctor's office is the feeling of being hurried through an appointment. You sit in the waiting room for what feels like forever, only to get a few rushed minutes when it's finally your turn. This problem is especially difficult for older patients because explaining symptoms often takes more time, and conditions are rarely simple. Unlike younger patients who may come in with one or two straightforward issues, many seniors deal with multiple health concerns at once. Arthritis, high blood pressure, diabetes, memory lapses, each one affects the other. Describing all of that clearly can't be done in just a few minutes. But too often, that's exactly what seniors are forced to do because doctors are under enormous time pressure themselves. The result? Important details get missed. A symptom that might seem minor on its own could actually be the missing piece in a much bigger puzzle. But when appointments are rushed, those clues never get connected. For example, a patient might mention dizziness, fatigue, and poor sleep, only to have the conversation cut short after the first complaint. In reality, all three symptoms together could signal something serious like heart rhythm problems or side effects from a new medication. But if the doctor doesn't hear the full picture, the opportunity for early treatment is lost. Medication reviews are another common casualty of rushed visits. Many seniors take 5, 10, or even more prescriptions at once. These drugs can interact in complicated ways, and sorting through them carefully requires time. Unfortunately, in a hurried appointment, doctors may only glance at the medication list without exploring how those drugs might be causing new issues. This is why so many older adults experience side effects that go unnoticed until they lead to bigger problems like falls, confusion, or hospitalizations. Why does this happen? It isn't always that doctors don't care. The healthcare system itself is often structured in a way that rewards speed over thoroughness. Physicians are pressured to see more patients in less time, which creates a situation where seniors, who require more attention, often get the short end of the stick. And because older patients tend to be polite, respectful, and sometimes hesitant to take up too much time, they don't always push back when a visit feels rushed. So, how do you make sure your concerns don't get lost in the shuffle? The first step is preparation. Before your appointment, write down your top 3 concerns and put them in order of importance. That way, even if time runs short, you've made sure the most urgent issues are discussed. Hand that list to your doctor at the very beginning of the visit. This shows that you're organized and serious about being heard. Another strategy is to bring a medication list that's clear and up to date. Write not just the names of the prescriptions, but also the dosages when you take them and any side effects you've noticed. Handing over that paper can save time and ensures nothing is missed. You can also ask directly, "Can we set aside a few minutes to review my medications?" Framing it as a specific request makes it harder to brush aside. If your appointment still feels rushed, don't be afraid to slow it down. A simple phrase like, "I have one more important concern I'd like to discuss before I go," can refocus the doctor's attention. It signals that you value your health and expect your concerns to be taken seriously. Most physicians will respond when patients assert themselves respectfully but firmly. It's also worth remembering that you're allowed to schedule longer appointments. Many clinics offer extended visits if requested in advance, especially for patients with multiple conditions. It may cost a bit more time or paperwork, but the peace of mind is worth it. And if your current doctor consistently rushes you and leaves you feeling unheard, it may be time to look for a provider who specializes in geriatric care, someone trained to handle the unique needs of older adults. The bottom line is this: your health deserves more than 5 rushed minutes squeezed into a packed schedule. The stakes are simply too high to accept being brushed aside. Every detail you share matters. Every question you ask matters. And every minute you gain back in a rushed appointment could be the difference between catching a problem early or facing it too late. So let me ask you, do you feel your doctor spends enough time listening to you, or do you often walk out feeling rushed? Share your thoughts in the comments. Your story could help another senior recognize that they're not alone, and that they deserve better care too. Truth number 3, many doctors rely too heavily on test results. In today's medical world, lab tests and scans are often treated as the final word in diagnosing a patient. Numbers on a page or images on a screen can feel objective and reliable, but here's the uncomfortable truth. For older adults, depending too much on test results can be misleading and sometimes dangerous. Many seniors know the frustration of hearing, "Your labs look normal, so you're fine," when deep down they know something isn't right. The problem is that not everything affecting your health shows up in standard tests. Subtle conditions, especially in older bodies, may not neatly fit within normal ranges. And when doctors lean too heavily on numbers, they risk missing the bigger picture. Take memory changes as an example. A senior might notice difficulty recalling recent events, losing track of conversations, or forgetting where they put things. Yet when routine blood work comes back fine, the concern may be brushed aside. What often gets overlooked is that early cognitive decline can develop quietly, long before it shows up clearly in medical testing. Early intervention, like lifestyle adjustments or cognitive exercises, can make a huge difference, but only if those concerns are taken seriously instead of being dismissed because the labs look good. Fatigue is another common case. A senior who constantly feels drained may undergo the usual panel of tests: blood counts, thyroid levels, vitamin D. If everything comes back in the acceptable range, the doctor may stop there. But fatigue can stem from far more complicated issues like sleep apnea, subtle nutrient imbalances, or even the side effects of multiple medications. Relying only on lab results without carefully listening to the patient's experience leaves these causes undetected. Vitamin deficiencies highlight another gap. For instance, B12 deficiency is more common in older adults due to changes in digestion, yet it can cause neurological symptoms long before blood levels dip below the normal cutoff. A patient may be told they're fine while they're actually experiencing tingling, weakness or confusion caused by low but not technically deficient levels. This shows how normal ranges don't always account for the unique needs of seniors. So why do doctors lean so heavily on tests, you might wonder? Well, in part it's because tests are quick, measurable and, well, easy to defend. If something goes wrong, a doctor can point to lab results and say the data looked normal. Listening carefully to a patient's story, on the other hand, takes time and skill, and that doesn't always fit into the modern system of rushed appointments. But here's the truth. No test result can replace the value of paying attention to how a patient actually feels. For seniors, the consequences of being overlooked in this way are, quite frankly, serious. When doctors ignore symptoms because tests don't show anything obvious, conditions are left to progress unchecked. That could mean heart disease advancing silently, early dementia going unrecognized, or depression being brushed aside because lab numbers don't reveal it. The result is delayed treatment, unnecessary suffering, and lost opportunities for a better quality of life. So what can you do if you're caught in this trap? First, trust your instincts. You know your body better than anyone else. If you feel something is wrong, don't let a piece of paper convince you otherwise. Be persistent. Say, I hear that the tests look fine, but my symptoms are still real. What else could this be? That pushes your doctor to think beyond the numbers. Second, keep a detailed health journal. Record your symptoms, when they happen, how severe they are, and what seems to trigger them. This creates a clear record that goes beyond what tests can show. For example, if you can say, I feel exhausted every morning after taking this medication, that evidence can't be dismissed just because blood work doesn't reflect it. Third, consider specialists. A general doctor may stop at routine labs, but a neurologist, cardiologist or geriatrician may know what additional tests or assessments are needed to catch what others miss. Don't hesitate to ask for a referral. This truth may feel discouraging at first, but in reality, it's empowering. Because once you know the limits of lab results, you can demand more complete care. Tests are tools, not the whole story, and seniors who speak up, ask questions and refuse to be silenced by normal labs often get to the root of their problems sooner. Remember, your voice, your symptoms and your experience matter as much as any chart or lab number. No test can measure how you actually feel each day. As frustrating as over-reliance on tests can be, the next truth is even more difficult to face. Because it's not about what doctors miss, but about what they assume you won't do as an older patient. This bias can quietly rob you of opportunities to improve your health without you even realizing it. Truth 4. Some doctors assume seniors won't follow through. One of the most damaging but, least talked about biases in healthcare is the assumption that seniors won't follow through with lifestyle changes or treatment plans. This hidden belief honestly affects decisions in the exam room more than most people realize. Instead of offering you the full range of options, some doctors quietly decide what's worth it based on what they think you'll actually do. For example, let's say you complain of back pain that limits your mobility. A younger patient might be sent to physical therapy, given targeted exercises, and encouraged to stick with a program that could help them regain strength. But if you're over 60, a doctor might decide, without asking, that you won't keep up with the sessions or the at-home work. Instead, they may only offer pain medication or suggest you take it easy. The problem? That bias denies you the chance to improve and keeps you dependent when you may have been more than willing to do the work. This bias extends beyond physical therapy. Many seniors never hear recommendations for weight management programs, strength training or cognitive exercises because their doctors assume the effort would be too much or too late. In reality, countless studies prove that seniors can build muscle, improve balance, sharpen memory, and even reverse certain conditions with consistent effort. Age may change the pace of progress, but it doesn't erase the body's ability to adapt and improve. Why does this happen? Part of it comes from stereotypes about aging. Some medical professionals still picture seniors as frail, resistant to change, or stuck in old habits. Others think they're protecting you from frustration or disappointment by not suggesting challenging plans. But the truth is, these assumptions take away your right to decide what goals you want to pursue. No one should set limits on your health without your input. The consequences of this bias are, well, quite serious. When seniors are discouraged from pursuing therapies or lifestyle adjustments, they miss out on benefits that could dramatically improve their independence and quality of life. A skipped referral to physical therapy could mean more falls. Dismissing a recommendation for exercise could mean losing mobility sooner than necessary. Not suggesting nutrition changes could worsen chronic conditions that might otherwise be managed. So, how can you break through this barrier? The first step is to clearly communicate your willingness to take action. Instead of waiting to be told what to do, ask questions like, are there exercises that could help with this condition? Would a nutrition change make a difference? Is there a therapy program I can try before relying only on medication? Asking directly shows your doctor that you are motivated and ready to put in the effort. It signals that you expect more than the bare minimum. Another powerful approach is to share your successes. If you've already made changes like walking daily, sticking to a diet plan or learning new skills, tell your doctor. This challenges stereotypes and builds confidence in your ability to follow through. It also encourages your doctor to recommend more active treatment strategies instead of taking shortcuts. And if your doctor still seems hesitant to offer options, remember that you're allowed to request referrals. If you want physical therapy, ask for it. If you want a nutritionist, request one. The more you advocate for yourself, the more likely you are to access the full range of care available. This truth may sting because it reveals how easily opportunities can slip away due to hidden assumptions. But the good news is, you don't have to let someone else's low expectations define your health journey. Countless seniors prove every day that age is no barrier to improvement. From running marathons to mastering yoga, from learning new languages to building stronger bodies, older adults continually prove that commitment is possible and powerful. So here's your chance to inspire others. What's one healthy habit you've stuck with after 60 that proves people wrong? Go ahead and share it in the comments. Your example, honestly, might be the push another senior needs to believe in themselves and demand better care. Truth number 5. Seniors are sometimes seen as less urgent. This is perhaps the most difficult truth to face, and yet it's one of the most important to talk about honestly. In many healthcare settings, seniors are sometimes, consciously or unconsciously, viewed as less urgent compared to younger patients. It's not always malicious, and often doctors themselves may not even realize they're doing it. But the reality is this: when time, attention and resources are limited, younger patients are often prioritized for the most aggressive treatments, while older adults may be encouraged toward comfort care or conservative management sooner than necessary. Think about this for a moment. You've spent decades contributing to your family, community and society. You've accumulated wisdom, experience and resilience. And yet, when facing serious medical decisions, there's a chance that your needs may be placed a step lower on the priority list simply because of your age. That reality can feel deeply unfair and disheartening. Let's look at an example. Many seniors have quietly experienced cancer care. While treatments should be based primarily on the specifics of the illness, its stage, severity, and how it's affecting the body, research shows that older patients are often offered fewer aggressive treatment options than younger ones. A 65-year-old with early-stage cancer might hear, "We'll just monitor this," whereas a 40-year-old with the exact same diagnosis might immediately be referred for surgery, chemotherapy, or a clinical trial. The difference isn't always rooted in science. Sometimes it's a reflection of an assumption that older patients either can't tolerate the treatment or that it won't matter as much. But here's the truth. In many cases it does matter. Seniors can and do benefit from the very same therapies, sometimes just as successfully as their younger counterparts. This mindset isn't limited to cancer care. Heart conditions, neurological issues, even joint replacements. There's a quiet bias that younger patients deserve more urgency. A senior showing early signs of heart failure might be told to just adjust lifestyle, while a younger patient with the same warning signs is rushed into a specialist's office. The danger here is obvious. Delayed interventions can mean the difference between managing a condition effectively and allowing it to progress into something much more serious. Now, before we paint all doctors with the same brush, it's important to recognize that not every healthcare professional thinks this way. Many are deeply committed to advocating for seniors and offering them every possible option. But even in the best-intentioned environments, unconscious bias exists. It slips into decisions, into how treatment plans are explained, and into the sense of urgency or lack thereof communicated during appointments. So what can you do about it? The first step is awareness. Just by knowing this tendency exists, you're already in a stronger position to advocate for yourself. When a doctor recommends a treatment or decides not to, don't be afraid to ask why. A simple question like, "Would you make the same recommendation if I were younger?" can be incredibly powerful. It gently challenges the assumption and forces the provider to reflect on whether age is playing too large a role in their decision-making. Another strategy is to bring someone with you to appointments, whether that's a spouse, adult child, or trusted friend. Having another voice in the room not only offers emotional support, but also communicates to the doctor that your care is valued and important. It makes it harder for anyone to unconsciously dismiss your needs as less urgent. It's also worth emphasizing that seniors today are more active, more health-conscious, and more capable than ever before. You're not simply a number on a chart. Your vitality, your goals, and your future matter just as much as anyone else's. The next time you're presented with limited options, don't hesitate to say, "I want to know all the possibilities available to me." You're not being difficult, you're being proactive about your health. Emotionally, this truth stings because it touches on a fear many older adults carry silently, the fear of being overlooked or dismissed. But here's the empowering side. Recognizing it allows you to fight back against it. You're not powerless in the face of medical bias. With the right questions, persistence, and confidence, you can ensure that your health is taken seriously, your time is respected, and your options are fully considered. And finally, let's be clear, this isn't about distrusting doctors. It's about working with them, but from a place of equality. You bring a lifetime of experience, resilience, and self-knowledge to the conversation. Pair that with your doctor's expertise, and you create a partnership where your age is seen as an asset, not a limitation. So, while this truth may be uncomfortable, it's also empowering, because once you know it, you can push back. You can demand the urgency, respect, and care you deserve. And in doing so, you're not only protecting your own health, you're also setting an example for every senior who comes after you. This doesn't mean all doctors think this way. Many care deeply and fight for their older patients. But by understanding that this bias exists, you give yourself the tools to stand up, ask more questions, and refuse to be quietly sidelined. Your health matters. Your life matters. And it's up to you to make sure it's treated with the urgency it deserves. Now, you know the 5 truths that many doctors won't openly admit about how they see older patients. And yes, some of these truths are hard to hear. But here's the good news. Awareness is your greatest weapon. Once you understand the hidden biases and blind spots that can affect the care you receive, you're no longer caught off guard. Instead, you're prepared, alert, and ready to take control of your health journey. The transformation begins with confidence. You have the right to ask questions, to request clarity, and to seek a second opinion when something doesn't feel right. You have the right to demand that your symptoms, your voice, and your life are taken seriously, regardless of age. By doing so, you shift from being a passive patient to an active partner in your own care. This doesn't just improve the quality of treatment you receive, it reduces frustration, prevents mistakes, and ensures you're offered the full range of options available. Most importantly, it gives you peace of mind, knowing you're doing everything possible to protect your health and your future. So remember this. You're not just a patient in the room. You're the most important advocate for your well-being. And by standing up, speaking out, and staying informed, you can make sure your health is treated with the urgency, respect, and dignity it deserves. If this video opened your eyes, hit that like button and share it with a friend who needs this reminder today. And if you want more practical tips to protect your health and independence after